Rural health is incredibly important, and rural America is very important. And I always say when I'm talking with folks, your geography and your zip code should not dictate your health status. Lisa Davis, Director of the Pennsylvania Office of Rural Health and an Outreach Associate Professor of Health Policy and Administration at Penn State. National Rural Health Day is a day that has been set aside by our national organization called the National Organization of State Offices of Rural Health as a way to recognize the importance of rural communities, rural health care, and rural America. It was started in 2011, and it's always been held on the third Thursday of every November. And it's a way to honor the power of rural across the country. There are really three main issues, all that fall under the general rubric of access. The first is access to providers, whether that's physicians, physician assistants, and so on, and to facilities, hospitals, clinics, outpatient services, and EMS. The second is payment mechanisms, whether it's Medicare, Medicaid, commercial insurance, private insurance, and especially when individuals are uninsured and are needing uncompensated care. And the third is really looking at the infrastructure, buildings, roads, and right now, internet has really become a big issue. When we look at rural communities versus urban communities, we see that rural residents tend to be older, sicker, and poorer than their urban counterparts. They also tend to have more chronic healthcare conditions. They have much less access to healthcare services. And the others are really very much related to geography, isolation, and the way in which the geography contributes to that isolation, to the fact that we have much lower density in rural communities than we do in urban areas, all contribute to the fact that when you live in a rural area, your access to healthcare services is diminished, even though those healthcare services are of very high quality. 80% of the landmass of the United States is rural, but 20% of the population of the country lives in those areas that are rural. And all of our food, for the most part, except for urban farms, are grown in rural communities. Logging is especially important in rural areas, so the logging industry contributes to house building, regardless of the geography. And also the crops that are grown, such as cotton and so on, to make clothing, also come from rural areas. So rural is vitally important to the health and welfare of the United States overall.